You and I in a series of getting and staying healthy together. Hi, I'm Rhett. This is my friend Amir. Amir is a doctorate of pharmacy, and he has a very unique, actually. We own a couple of pharmacies in Indian River County and St. Lucie County, and they are compound pharmacies. Now, I never even knew about compound pharmacists until a few years ago, meeting you. So we can talk about that. We're going to talk about a few subjects. Let's just give them an idea of what we're going to be covering today, Amir.
Yeah, so today we really want to hope to cover a few topics. One, we want to talk about the FDA's latest move in removing the black box warning from hormone replacement therapy. I think that'll be of a lot of interest to your listeners, and especially women.
Okay.
We want to talk a little bit about weight loss medications, the good, the bad, and the ugly. There's so much press on it out there right now. And then we'll finish up maybe with a little bit of talk on peptides. I know you and I were talking off air. You know, what's the buzz around peptides right
Yeah, and I have no idea what that is, but oh, this sounds like fun. Okay, so if you care about your health, you're not going to want to miss this broadcast, all right? And Amir's, he has two pharmacies, with the one in Indian River County is out on Route 60. It's called Perkins.
Yeah, Perkins Compounding Pharmacy on State Road 60. There's a couple in town on the Compounding Pharmacy on State Road 60. And then we also have a location, Butterfield, in Port St. Lucie, right next to St. Lucie Medical Center. Both full-service pharmacies, but we specialize in pharmacy compounding. And we also do medical supply down at Butterfield's.
Oh, do you? Now, I wanted to ask you this. So why, Amir, your dad, you have how many children?
5 children.
5 children? You're going through the humble years, right? Okay, so you have 5 children. Congratulations.
Thank you.
And I met your wife. You have a beautiful wife, beautiful family. You're a man very blessed. What in the world gets somebody into? When did you know you had a proclivity for pharmacy? Because I used to work as a young guy when I was in college at Albany Medical Center. Had a 12-hour shift there, and I got to meet a lot of the doctors and a lot of the pharmacy school was right next door. You really have to be as bright as a doctor in order to become a pharmacist. Matter of fact, even more so, because sometimes they'll sketch out something that's wrong, and you guys kind of have to catch it and go, well, you don't want to, that won't mix well with this medication, et cetera.
Well, our doctors are amazing at diagnosing and understanding what's going on, and then we come alongside as a really good partner, right, to help them make sure they've got the right and accurate medication to treat what it is they diagnose. So we definitely appreciate them. But I guess, how did I get into pharmacy? God just opened certain doors to me. I worked at a grocery store, a lot like Publix. It was in Michigan. And I started in the recycling room in Michigan. You get 10 cents if you bring your can back. And so I would collect all the cans and count it. He'd tell the cashier, hey, give this guy $1.20, and so the pharmacist would walk through the recycling room to go to the bathroom. And so just developing a relationship with him over time, he finally invited me to come work in the pharmacy.
Really?
So this is just a part-time job during high school. And I liked it. I enjoyed it. I liked interacting with people. I liked being able to at least grab the pharmacist and say, hey, can you give them a recommendation on how to feel better in this instance? And so I really enjoyed it. I wasn't sure that I had the intelligence or the intellect to actually make it into pharmacy school. And so over the years, I got a couple of certifications as a technician. And finally, the pharmacist said, hey, I think you can do it. And I was already kind of bluffing like I was going to go. I was like, I'm going to do this. I'm going to do that.
Sometimes a word in season from somebody can just make all the difference in the world.
100%. And so to the bluffing portion, it was really, I was dating my now wife, and I wanted to sound like I was doing something important with my life that somebody should want to be with, But so the pharmacist says, hey, I think you can do it. I think you can go. So that was like scenario 1 that pushed me in that direction. Scenario 2, when I was a child, I had terrible poison ivy. So in Michigan, we split wood in the summers for the cold winters, and it was hot. And so I would be out in shorts and nothing else, no shoes, no shirt, and we would carry wood from wherever on the property, up to where we burn. I had poison ivy head to toe.
Really?
Everywhere in between.
And that can be lethal in the worst case.
It felt like it at the time. I mean, every portion of my body was covered. And so I went to see a doctor, got a prescription for what's called a steroid dose pack. Many people have seen them, a square box, take 6 on day 1, 5 on, day 2. Went to a Walgreens of all places, gave the prescription to the pharmacist. He gave me this.
You would later end up working at Walgreens.
For 17 years, paying them back, right? But this medication was like a cure, right? Like a magic cure. So within hours to days, the inflammation was leaving my body, the itchiness, the swelling was leaving my body. In 2 days, I was completely normal again. And so I think those two events together, the magic of medicine that I felt and how much it helped me personally, and then somebody saying, hey, I think you can do it, really pushed me in the right.
You're just shocked at how frequent that happens. I've been doing for radio now. I'm in my 32nd year. And so I've met a lot of people, a lot of doctors. I broke my leg when I was a kid playing soccer. Went to see the doctor, healed me. They become an orthopedic surgeon. You go there, you get healed of this poison ivy. What do you want to do? Some reason when we get a gift and we're really appreciative, we want to pass that along and give back.
Yeah, absolutely.
And I think God's in charge of stuff that happens like that. It gives us compassion and a depth of character. It just so happens that you had the ability to do this too. So really very interesting. I know that members of my family use Perkins, your pharmacy out on Route 60 in Vero Beach for compound.
Yeah.
And so what? Let me ask you. So I've got some questions, some things I've done here. Tell us a little bit about your background. We got that. How does compounding differ from traditional pharmacy?
Yeah. So in traditional pharmacy, we have a few different conditions we treat. We treat acute conditions, which are things like a cold, maybe something really bad during allergy season, something that's immediate. It's something that's making you sick in the moment, right? We're treating it with an anti-infective or something of that nature, and you go back to living healthy. And then there's chronic disease treatment, right, in pharmacy, where we're treating your high blood pressure, your high cholesterol. We're trying to manage your diabetes, or Alzheimer's, things like that. That's traditional pharmacy, right? So in the compounding space, we are forward-looking. We're really looking to create innovative compounds to help people stay healthy. This is ahead of the curve medicine, so to speak, right? So instead of waiting until your diabetes is out of control or your cholesterol is out of control or you're on the brink of a heart attack, right? We're looking to create personalized solutions, to your body chemistry, to your weight, to your blood levels. And in order to do that, you have to have very precise amounts of specific medications within the drug. You can't do that with traditional pharmacy. The pill comes in a 25 milligram, 50 milligram, and 100 milligram. The one-size-fits-all approach. You got to take one of these. There's nothing in between. We flip that. When we compound something, we do it down to what's called the microgram, right? Exactly what you need to get the symptom relief that you need or to change your body chemistry.
For instance, my wife is 5'2". She's a little petite and it weighs 93 pounds. I'm over 300 pounds. So I'm going to need you can't give the same prescription to her that you're going to give to me.
So over the course of a month, right, I'll make 1,000 unique formulas for 1,000 different people that are completely.
You're a chemist, a chef with recipes.
They often say that compounding is a lot like baking in a very clean and sterile environment.
Yeah. And boy, one little ingredient can make all the difference too.
100%. And it's such tiny amounts of medications that we deal with. And so you'll see a lot of places will say that they compound, right? The primary thing is they do traditional pharmacy. Mm-hmm. And then in order to make a little bit of extra revenue, they'll say, we compound as well. They don't do it very often. Their equipment may not be sophisticated, but they're technically allowed to do it, right? So if you think of restaurants, there's a scale of restaurants, right? You can go to a fast food joint and get food, and you can go over to the Tides of Vero Beach and get food.
They drizzle it,
Where they drizzle it, right? One is precision and with excellence, and the other one is fast and barely meets criteria. And so
one has love and one doesn't.
Fair enough. But very important to select the right compounding pharmacy. Just because they can compound does not mean that they're an expert at it. It doesn't mean that they have the proper equipment to do it to such precision. And so that's what we've really dedicated our professional work to in both locations is, precision personal compounding with excellence.
Wow, that's really cool.
Yeah.
Okay, there's a few things we're going to discuss today. Now, at the top of my list, of course, are these things where people are losing weight because I tried that last year. Remember, starts with an M.
Yeah, Manjaro.
Yeah, Manjaro.
How did that go for you?
Not good. I was on it 2 weeks. I went to the emergency room, and I was up in Vermont in Burlington.
Okay.
Because of palpitations or some feelings in the heart.
Yeah.
And then I went to the another town near there another night, and that's when the pharmacist says, not the pharmacist, the physician, and he said, you need to get off of this. These symptoms are not good. Now, what happened is I self-medicated. Okay. I was at Barnes & Noble. It's 9 o'clock at night in Burlington, Vermont. I love bookstores and libraries. Mm-hmm. And all of a sudden, I'm starting to feel, ooh, what was it? So I took a half of a Toprol.
Okay.
I said, I'm the kind of guy that never liked to go to doctors when I was younger. I'm getting older now. I got to go to. So I said, take yourself to the emergency room. Never done it in my life. I get there. Then the nurse, the most wonderful young people working there, but this nurse comes in and he goes, he said, I guess it's your pulse. Mm-hmm. He said it was down to 30. Now that's going to mean something to you. I said, what does that mean? He said, if you'd taken the other half of the topol, you would have put your heart to sleep. You'd be dead.
Yeah. Yeah.
So don't self-medicate. What's the lesson there, right?
Call a pharmacist, call your doctor.
Now,
Call somebody.
now my nephew, who I just went to see, remember I was over there for the holidays, and he's maybe 60, 61, and he's lost 55 pounds, not on Mounjaro, but the other stuff.
Okay.
And he's doing great.
Yeah. Yeah, a lot of patients, most patients will do extremely well with it. There's a couple of things to consider. Some people will elevate the dose too quickly. Do you remember where you started at? From a dose?
I never got, I was only out of 2 weeks.
Gotcha. So, depending on the physician that you're working with and how quickly they want you to see results is where they'll place you from a dose perspective. Mm-hmm. You didn't gain the weight overnight, and I always recommend not trying to lose it overnight, even when you're utilizing it.
Who take it off in an accelerated fashion end up having other challenges later on. I think don't you agree with it? The body needs to adapt slowly.
Yeah, I think slowly is the right way to do it. Plus,
that's why I go on a diet. My mother would be in it one day. Now, don't do too much.
There's some wisdom in it, though. We always find that if we can get a patient to just start one healthy habit this week, it's going to be way better than them trying to start 9 healthy habits, because they'll do it today and they'll do it tomorrow. But when Sunday comes around and all the guests are coming over, or this is happening or that is happening, they will completely drop the program, right? But if you can say, hey, we're going to do one healthy thing this week, right? We're going to walk for a half a mile 7 days a week. That is all we're going to do. We're not going to have you stop going to McDonald's.
He keeps trying to get me to walk. One of these days we're going to walk together.
Next time we interview, I'm not coming on the interview unless we walk the bridge together. Deal. Okay? Right on. But nonetheless, low and slow is the way to do it. Elevating the doses on these GLP-1s. So just so that for the listeners, there's a couple of different ones. One is
GLP-1.
Yeah, so the weight loss medications are broadly referred to as GLP-1s. So, and it's named by the peptide, right, within the body that they're mimicking. And these GLP-1s do a couple of...
What does peptide do for you?
So peptides are typically natural signaling molecules, meaning these are the small amino acids that are floating around your body right now that is indicating what your body wants every cell to do, right? So if we want to secrete more insulin to bring your blood sugar to an appropriate level, there's a peptide within your body, a signaler, if you will, that will tell the body to secrete insulin. It will also tell the cells, hey, get ready to receive this glucose. It's coming out of the blood and into the cells. So throughout our body, there are thousands of different peptides that are signaling us to do different things. Signaling tissue repair, signaling to start burning fat, signaling us to say, you're full. You don't need to eat. Amazing new field.
Are we in the embryonic stages of discovering these things?
So they've really been around for at least 5 to 10 years, but the safety and efficacy of utilizing these as therapies is just really coming to light in the last 4 or 5 years.
Let me ask you this. I have a friend, he's Greek, so I call him Michael the Greek. We're good friends. Now, Michael will literally, I'll go out to, we're going to go have an Italian dinner. Mm-hmm. And he'll say, oh, I had a pizza an hour ago. And he's skinny as a rail. Yeah. This guy eats all day long. Yeah. And yet I walk by a pizza place and smell it and I gain weight. Yeah. So are we ever going to figure out this metabolism thing?
Well, metabolism has a couple of different components. So one is genetics. Some people are just going to always have a higher running metabolism than you and me. It doesn't seem fair.
This is metabolism. Is it the heart? Or
so that's a portion of it, but the greater portion of metabolism is how well our body is utilizing stored energy. That's already within our fat cells, as well as energy coming in. So at what rate is it burning that in the powerhouses of our cells? So we talk about mitochondria. Have you heard that term before?
I've heard that word.
So mitochondria are the powerhouse of every cell in the body. And that powerhouse can run at different rates. It can run at 100%, it can run at 90%, it can run at 60%. There's a lot of different factors that go into it. Does your body believe that there's an excess of calories around? Are you fasting, or are you eating foods that are very low in nutrition, maybe high in calorie, but low in nutrition? If so, your body's saying, hey, we can store that stuff as fat, but it's not really what I need to run my body efficiently. So it'll slow your metabolism down. There are also, getting back into the peptide world, there are certain peptides that deplete over the course of our lives. So we'll talk about NAD, right? NAD is needed for those mitochondria to function properly, right? It's needed to oxidize fat, right, when it's in our bodies to use it for energy. Well, it's very high when you're born, and it slowly declines with age, right? Just like every other precursor and hormone in the body declines with age. But now we have targeted interventions, right, where you can replace some of those key peptides like NAD plus to actually re-rev your metabolism, right, and help you to burn fat, hopefully, right, at a higher rate, bring yourself into a more healthy state metabolically. So really neat stuff there. There are ways to rev your metabolism, but it's very difficult. And in a busy world, you got to have an expert.
This stuff's important because it affects you psychologically.
Yeah.
Yeah, I was young, thin, pretty handsome guy when I was younger. I didn't start to gain weight till my 30s. What the heck happened here? Yeah. Of course, I believe that the trans fats were a crime committed against humanity.
Tell me more about that. What do you mean?
Trans fats. Well, okay, if you eat love food, your mother loves to feed you, it's got love in it.
Yeah.
Your uncle, your grandfather, or a chef that loves what he does.
Yeah.
But money food, like McDonald's and all this stuff, there's no love in that stuff. Yeah. And I know you're going to think I'm crazy about this, but I actually believe, like for instance, having you, knowing that how much you love this.
Yeah.
You're a great pharmacist to me. I would want to use you above anybody else because I've had Dr. Plains was in here. Yeah. I said, did you know what you were going to do when you were young? He started pulling his friend's teeth when he was in 8th grade. Right there was the orthopedic surgeon, Dr. Steinfeld, sat right in the seat you're in. I said, do you like what you do? He goes, I love it. And I was told by a professor once at Rensselaer Polytechnic Institute, he said, how quick people answer. Sure, sorry about that. But, you can see that you love this.
Yeah.
And that's the kind of person you want helping you, But I think that the trans fats, and that's why in New York maybe they made it illegal, because if we sued Procter & Gamble, it may put a big hole in our economy, and we'd have a big sucking sound. That wouldn't be good. So they kind of like, okay, just make them illegal and let's get out of this, right? What do you think? There's been
a lot of talk about ultra-processed food and the role that it plays in our current disease state crisis, I'll say. Over 50% of the adult population has some sort of chronic disease. Yeah. Our children are heading in the same direction. And a lot of it is linked to being sedentary, right?
Yes.
And then this ultra-processed food. And they haven't been able to really define ultra-processed food, but I think we can kind of do it pretty easily, right? It doesn't occur in nature. It's not on the outside of the grocery store, right? It's not fruits, vegetables, meats, soups, things of that nature. It's pre-packaged, pre-canned, doesn't look like anything that ever grew from the earth. We can probably say it's.
What do you think about Kennedy taking out red dye number 41 or whatever it is?
Yeah, I think it's a really good start. It's a really good start, and I'm glad somebody's focusing on that. I don't think that at the government level they're going to significantly change health outcomes.
Okay.
Right. Not by just removing the red dye. It's much more work that needs to be done. Right. So, there's an hypothesis that potentially red dyes and the blue dyes, can cause kids' behavior to be uncharacteristic or unruly. My wife will swear by this, right? If you're a grandparent.
Was she homeschooling your children?
She homeschools
her children. 5 children. She's home. I think we need to listen to your wife.
For sure. But the grandparents know they're not allowed to bring any cupcakes over that have red dye or blue dye. It's just a no-go. She thinks that their behavior and their cognitive abilities are much better when they don't ingest that sort of food. Have I seen a ton of studies that support it? Honestly, I haven't gone to look for it. There's so much more low-hanging fruit that we should be focusing on as healthcare providers.
Is there a fruit you can eat, speaking of fruit, or something to kill the appetite?
Fruit to kill the appetite.
That Nino juice or Nino juice or whatever was going around.
I don't know that there's any magic trick to killing the appetite with fruit. I think you eat whole fruit, right? We're not eating applesauce. We're not drinking apple juice, right? We're eating a whole apple, the peel and all.
So apple juice aside is not as good for you as apples if it's made of 100% apple?
No, 100% fiber out of that. This is all the good food that feeds your gut and your gut bacteria, and you're just drinking the sugars with a bit of the apple.
How about apple pie?
So we all love apple pie, and I think if it's made with love, you should have it on your birthday and maybe on Christmas, you know.
You can try it. See, I'm trying to manipulate him into this going like, yes, you should eat apple pie every day.
Yeah, yeah. No, you know, we should enjoy foods, but
Yeah.
we should enjoy them on the specialist of occasions, right? Or if you're with a friend or with somebody you love, go ahead and enjoy that thing, right? It's part of the experience. If you and I go to Tides together and have dinner, I'm going to have creme brulee, right? And we're going to enjoy that experience together.
If you want to go, I'll take it. We'll go.
Yeah.
They have the best swordfish.
They're everything is the best. I get what is it? Not the prime bread. Anyways, filet with
Those ladies, Leanne and her partner there, they love in the food.
I love to
They
say.
go there. I said, how can this taste as good as it did when you opened up 15 years ago?
Yeah.
You would think people get kind of tired or get, kind of, and it's just like, bam, boom,
The consistency is relentless, right? And that's what I appreciate so much about what they do there. But nonetheless,
Yeah.
food, enjoy it in those special moments. The reality is the majority of us are enjoying whatever, a Chick-fil-A milkshake in our car all by ourselves, or we're
Now we know where you go.
So-
I interviewed the CEO of that, the guy who started
The
it.
Chick-fil-A?
He was a very dedicated Christian man. Very nice.
Yeah, I can imagine. They call it Jesus.
Just no longer alive now. But
Truett.
that's Kathy Truitt.
He Truett.
He invited me up, and I never went up. How stupid! I got a billionaire invites me up to his office in Atlanta. Well, anyway,
But anyway, so that's with food. But
by the way, how is Chick? We shouldn't pick on them, but I did try their grilled chicken recently. Honestly, everybody would like fried.
yeah.
The grilled chicken actually, and they have a broiler in the back, so it has those black ribbons on it. And those are in it. They do that's fresh chicken. It's actually has more flavor than the fried chicken.
Yeah,
Try it.
100%. I think.
It's like 75 less calories.
I think if you're going to Chick-fil-A, definitely do the grilled chicken. If I could do the salad, got to be careful. Salad dressings, there's some of the worst substances on the planet for your heart, right? They're typically
Is what?
salad dressings. So typically the sail and oil, they deep fry French fries and fried chicken in.
How about balsamic vinaigrette?
Solid. Go with
Good.
solid.
I fall in love with white balsamic vinaigrette.
Yeah, anything that's in the vinegar line, or if it has olive oil is the main ingredient, you're good to go. You got to watch out for a majority of salad dressings are just soybean oil, and so those are what.
Dr. Sinatra, before he passed away, was a guest on my show every week for years. He said the mafia got involved in the olive oil in Italy. He said, and they cut it with canola oil. He said, you want pure, go to California because they're regulated, and every month everybody's tested.
Yeah.
So I don't know how true that is.
Yeah, and canola oil is terrible for you. My absolute best. So it's come from a rape seed. Is actually the name of it.
Yeah.
They seed, rape seed, and they said, well, that's not appropriate name. Nobody wants to buy this, right? So they changed it to canola oil, which stands for
Rapeseed.
Yeah,
Rape's not. Why did you name it?
It's like Canadian acid low oil or something, or low acid, low Canadian something. But anyways, that is an acronym, right? Because nobody wants to call it what it really is, but very terrible for you.
By the way, just a little aside here. As I said, I trust you, and of course I know you, and so that's why you're on here, and I endorse you. But if somebody comes in and wants to counsel with you, can they sit down with you, or did you call ahead, call the pharmacist? Look,
Yeah, absolutely. So if you're in here, Vero Beach, it's Amir at PerkinsVB.com.
out on Route 60.
Yeah, we'll throw it up on the screen, and you can definitely grab some time for me.
We have listeners in Port St. Lucie. Where are you located there?
Yeah, so in Port St. Lucie, we're right off of US Highway 1, right south of Crosstown, and it's Amir at ButterfieldRx.com. You can email me there, and I can set up time to talk with you about whatever it is.
That's wonderful.
Whatever healthcare topic. People need help and guidance, and some people have wonderful physicians, right? And I work with wonderful physicians all over the Treasure Coast here. And some people have physicians that have very limited time with them, and that's where I can really come in and be of value. And if you don't have a physician, but you're interested in some of these new and novel, innovative compounds and preventative medicine. I can get you connected with some of the really best doctors all throughout the Treasure Coast.
So it's good that you have relationship with all these doctors.
Yeah, absolutely. We work really hand in hand to make sure that we're developing the best patient outcomes, which kind of unintentionally, but over the years has really blossomed into really great relationships with all of the forward-thinking physicians in town.
Now, there were some others, we talked a little bit about the weight loss and peptides. Now, what was the other thing we're going to discuss?
Yeah, so in the news, there's been a lot of buzz recently regarding the FDA coming out and saying they're going to remove the black box warning.
And what does that mean?
Yeah, so the FDA will literally put a black box on the side of a medication, and it's its highest level of warning to both patients and providers that this medication may have serious adverse health outcomes. So proceed with caution.
So how do you feel about that?
So, this black box warning was put on there 20 years ago after the WHI trial.
Are we talking about anything specific here?
Yeah, so it's specifically estrogen, right? So we know that estrogen is the primary female hormone.
And it declines as they get older.
It declines as they get older. And so they looked at this study in 2001 rather. And the results came out and they overstated the potential negative side effects of it. They said women potentially are going to have strokes and they're going to have heart attacks. And this is really bad stuff. And almost overnight, right? 2001, I'm just a technician. So
Overnight what?
overnight, every woman stopped taking bioidentical hormone replacement.
Well,
Stopped taking estrogen.
so a doctor put me on, a female doctor in town here put me on testosterone as a male.
Right.
He was in the 70s. And I woke up the next morning feeling a little odd. And then I read, #1 side effect is death by stroke.
Yeah.
I said, I'm not taking this anymore.
Yeah.
You know?
So this is some of the warnings that have been put on there by the government.
They've been excessive, the warnings.
The warnings have been excessive. Now, as we look back 20 years later, they say, well, we really overstated that. In fact, it is not causing, more heart attacks in women when they take what's called bioidentical hormone replacement.
Yes.
Meaning an estrogen that's the same estrogen that's already in their body. However, the trials that they based it off of was not on bioidentical estrogen. It was on a man-made synthetic estrogen, right? It's actually derived from horse urine.
And you're saying that's not good.
That was what was used in the trials, and that's what showed an increase in heart attacks and strokes.
Horse urine.
However,
However,
it got applied to every form of bioidentical hormone therapy.
Yeah.
So is this news to me that the FDA is realizing that, hey, we made a mistake? No. I've got thousands of patients between Indian River County and St. Lucie County and around the state of Florida that I make compounds of bioidentical hormones for. There are providers all over the Treasure Coast that have known this is baloney, for decades, and they've been taking care of their patients in the proper way, right?
so you're saying there is a testosterone that I could take?
Every patient is different, and we'd have to look at your individual,
Obviously, it's getting it.
But yet, for a lot of men, even in their 70s, testosterone can be a huge benefit. It can help you lose weight, maintain muscle, bring back the memory fall.
How does testosterone help me lose weight?
So testosterone is going to help you preferentially put on muscle. Muscle is a main driver of the metabolism, right? We talked about that earlier. It takes a lot of calories, right,
Yeah.
to maintain your muscle and keep it. Testosterone is signaling your body, hey, good time to go ahead and put on muscle, right? And by the way, muscle is the #1 predictor of how long you're going to live, right? The stronger you are, the stronger you are, the longer you'll live. And we do some simple tests at the pharmacy. We have a hand grip machine.
Yeah.
And just testing your grip
Well, I'm going to come in and try
will
that.
be very predictive of your risk of dying, within the next year. So the stronger you are typically means you have more muscle, you have a better metabolism, right? You're going to potentially live longer. For women, right? So many women are falling victim to, literally falling, right? Falling and breaking a bone.
Oh, yeah.
What they came back and said is, hey,
Osteoporosis.
there's estrogen receptors all throughout the body, and it has a huge effect on bone strength, right? So now they're coming out and saying, actually, we said that estrogen was bad. We'll actually find that it makes bones stronger in women. 50% reduction in orbiting a fraction bioidentical hormone therapy for estrogen. And it started at the right phase of their life, right? 50% reduction in having a heart attack or stroke, which is the exact opposite of what the warning was saying. It's saying, hey, if you take this, potential life-threatening heart attack and stroke. Now we're seeing if you start hormone therapy around the time of menopause or before 60, you may actually have a 50% decreased risk of having a heart attack or stroke. So this is huge. Think about, your family, whether it have been your mom, could she have benefited from this therapy? For listeners out there, you may be in that what we call perimenopause range, right? Anywhere from 45 to 60 years of age. Think about having that conversation with your doctor. Is hormone therapy doctor?
Like just a regular general internist, or who?
It really varies. There are general practitioners that are very knowledgeable about hormones. And there are people who specialize in women's health and in men's health. And what I like to do is, if you reach out to us at the pharmacy or email me, and they'll put the email on the screen again, email me, I can connect you with the practitioner that's best for you. Everybody's a little bit unique. Everybody has different needs, and I can get you connected to the right person and be local to your area.
Wow.
Yep. But the big idea is the government's turning course, and they're starting to say what all of us in preventative healthcare medicine have known for a long time, that when we do it right, we do bioidenticals right, it can really improve the trajectory and the quality of women's lives.
Well, your average doctor goes to school for what, 30 years, let's say, about 30 years total, all schooling, to become a doctor. And I remember my cardiologist in town, he said, well, we're going to have to take you off the Toprol and put you on this. I said, why? The insurance company. But if it doesn't work, they allow you to go back. What do you mean if it doesn't work? I said, you mean I could have a stroke? He goes, yeah. Are you saying I could die?
Mm-hmm. Yeah.
And I'm thinking some guy who might have a high school diploma, who's working in some office for some famous insurance company, is dictating to my doctor, who's an intellect and went to school for 30 years, and subjugating his authority. Yeah. This has got to stop.
Yeah, and I think we've talked about this before, but the important thing to always remember is you have the power of choice, right? Insurance company may be indicating that they want you to do this or do that.
But they're trying to save money.
They want to save money. Now remember, you hired them, right? They work for you, right? And if you choose to go ahead and purchase a therapy that's best for you, you can always do that, right? If a doctor prescribes it, you always have the right to
it costs a whole lot more.
Sometimes it does. Sometimes, it could be $200 a month. Sometimes it's $12 a month. So it's worth asking your pharmacist, hey, if I just paid for this, like a 90-day supply and just paid for it, what kind of price could you give me? So often we'll find you got a $10 copay per month, right? So it costs you $30 over the course of 90 days. I can fill it for $26 for you cash, right? Even without the insurance, especially on generic meds. So don't let your insurance company drive your healthcare, right? At least ask some educated questions. Hey, if I went ahead and got the therapy that my doctor suggested was best for me, what would it cost me, right? And, if you go to a big chain, pharmacy, Walgreens, CVS, whatever, yes, they are going to run you through the ringer. You're going to pay top dollar for that. But if you come to somebody who's local, right, and really has a heart and passion for people, they'll give you a very, very fair price.
Yeah, speaking of that, I'm sure you learned a lot when you worked at Walgreens for 17 years, and now later in life you went into your own business and become a pharmacist. Yeah. So you know.
Yeah, Walgreens was a really good run. I think, you're actually my patient at Walgreens all the first ago.
Years ago, did you?
I
hope I behaved myself.
Yeah, I had a great experience. I learned a lot at Walgreens. By and large, they let me practice pharmacy the way that I wanted, with care and compassion. We had some limitations in what I could do around pricing and things, but they let me, practice in the way that I liked, and pharmacies flourished, right? And then they promoted me, and that flourished, and they promoted me and promoted me and promoted me. And that's how corporate America works, of course.
I want to give you enough so you won't leave.
Yeah,
not enough that they can't make more of a profit for their investment.
Yeah, golden handcuffs, but incredible people over there. But as a whole, looking for the best care in a county like Indian River or St. Lucie County, go with somebody local that you know. And that doesn't apply across the board. I've got friends who work for Walgreens, individuals who are amazing pharmacists.
Yeah.
But on the whole, it's hit or miss. You never know what you're going to get day to day.
Okay. Anything else we were going to discuss today?
So I think we talked about the black box warnings. This is a hot topic. Please have that conversation with your doctor. Reach out to me. You know, if you have a daughter who's coming amongst that age or a niece, this has got to be talked about. So that was number one. We talked about weight loss medications.
Yeah.
You know, by and large, they're very safe, right? If they're given and dosed in an appropriate fashion. So we want to make sure that we're doing that correctly.
They help kill your appetite.
They help kill your appetite. They help you better store energy appropriately. So it can bring your blood sugars down, which can really ruin your kidneys and your eyes over time. So they do a lot of great things there. We talked about NAD from the peptide perspective. You know, there's a couple of
What NAD stands for?
nicotinic, adeninic, something.
Sorry, I asked.
No, you're good. And so NAD is just what we refer to in the industry. But there's a lot of peptides that are getting a lot of attention if you're paying attention online. So one is BPC 157, so body protection protein 157. It was found naturally in the gut and the gastric juices. And we found when we give it to patients, it really accelerates healing.
Really?
Right? So it's not for everybody. If you don't have injuries, it's not for you. But if you're an individual who loves to work out and to weight lift or maybe play pickleball and you're having tendon injuries or other injuries that don't heal, the BPC 157 peptide is really an interesting.
So we're really rocking and rolling here. In other words, like now I have a friend of mine, he's 80.
Right.
He just drove down the other day, said, I couldn't have done this. He left 2:30 in the morning to head back to Tennessee. I said, because I have a hard time with my eyes. And I said, oh, so do I. I said, but he says, I pay that $99 a month extra. This Tesla drives itself all the way back to virtually to Tennessee.
Yeah.
So we're really moving along. Now, so too, the parallel, obviously, in the medical industry, this is like...
This is cutting edge.
We're rocking and rolling.
This is very exciting time for both practitioners and pharmacists. We've got a lot of new tools in our tool belt to help people age better, right? We're all going to continue to get older.
Let's hurry it up so I can get younger.
Well, you know, there is a ton of innovative therapies out there. People just don't know about them, which is really why I want to drive awareness, and I would come on programs like this, and I offer my email out freely to anybody. We can chat about it, talk about it, and I'll connect them with a provider that they can go a little bit deeper on. But if you're between the age of 45 and 85, there are compounds out there that can help you think more clear, can have more energy, can give you better cardiometabolic health. So for you and me, right, what are we worried about? We're worried about dying of a heart attack, right? There are ways that we can improve our cardiometabolic profile to decrease that risk, right, using these novel and innovative peptides. People just don't know about them.
Cool. Yeah, you'll have to counsel me on something.
Yeah, we can dive in a little bit more and maybe even.
Now, once again, we're talking with Amir. He's a doctorate of pharmacy. He's a compound pharmacist that differentiates him from the regular guy. And you have two locations. He owns Perkins on Route 60, correct? But it's specifically not like the other Perkins. It's a compounding
our pharmacy, yeah. So we're compounding forward. We do traditional pharmacy as well, but 90% of our day is really taken up in doing personalized, correct. But patients end up coming for compounding, and they love us, right, because of the relation aspect, and we end up doing traditional pharmacy as well.
Wonderful. Now, also, you have a location down in Port St. Lucie.
Correct. So that's Butterfield's pharmacy. So, you know, we do a few things down there. We're compounding focused, but we also serve the hospice community. So I have a huge passion around hospice pharmacies. I take care of.
Why do you have that passion?
You know, so in hospice pharmacy, everything is an emergency. We need it right now. The condition is changing. The patient is either having a seizure, right, which can be very difficult for the patient at the end of life or the family to see, or their pain levels are shifting, you know, very quickly, or all of a sudden the morphine's not working and we got to go to hydromorphone. Everything's an emergency. And I think one of the gifts that I have is that I work extremely well under pressure, and I love delivering under pressure. So I'll get a call from a nurse, hey, crisis care situation, patients, you know, being combative. The wife can't take care of the situation. Nurse can't take care of the situation. I need X there. No problem. I'll have it there in 14 minutes.
Wow.
Right? I love that kind of pharmacy. I love being there for those people in potentially their greatest hour of need, right? To deliver these medications. And so just a passion thing for me there. It's not a hugely profitable business by any means, but I love doing it. So I do it for St. Lucie County now, a bit for Martin County. Eventually, hopefully we'll be doing it in Indian River County as well. And just a passion project for me. And I think that I have the skill set in the team that can deliver excellence around it. I love being there for people.
Wonderful. Well, Amir, great to have you in here again, and see you again soon. Yeah. And you also have your own podcast. What is the title of it if people want to find your podcast?
Yeah, so I'm on the Dose Adjustment podcast. The Dose Adjustment. Yep, we're primarily focused on men's health. On that podcast, all things men. And you can catch me too on social media. Under the Butterfield's Pharmacy Facebook page, and we'll link to it.
And Vera's Voice and Rhett Palmer, Amir,
the whole idea is to get out good information to help people live the healthiest and happiest life possible. That's our mission. That's all that we want. And,
if I created about a podcast, it's like an audio library. And, you can be up at 2:00 in the morning and go, hey, maybe I'll listen to Amir talk about, medications again or whatever.
Yeah.
So. All right, well, thanks for coming on.
Yeah, it was a pleasure.
Hey.
Thank you, sir.